Thank you so much, Dr. Farrukh, for inviting me today on this podcast and for a very relevant and important topic of depression, anxiety, and sleep disorders. So, basically, depression is quite prevalent in Pakistan and other South Asian countries, and the main symptoms of depression are basically low mood, um, lack of interest in routine activities. Along with that, a few patients also complain of extreme fatigue and lethargy in their body. And all these symptoms may lead to disturbance in biological functions like disturbed sleep and appetite. And all these symptoms should be there for at least past 2 weeks. So if these symptoms are there, then we can diagnose the patient with depressive disorder. And as far as anxiety disorder is concerned, anxiety is concerned with related with excessive worry, and excessive worry may lead to some physical symptoms in the form of palpitation, in the form of increased breathing rate. It can also be related to some somatic and physical complaints like uh, body aches and pains, headache, and there can be a few patients also complain of increased frequency of urination and some gastric symptoms. And all these disorders, whether it is depression or whether it is generalized anxiety disorder or panic disorder, all of these disorders are pretty much treatable and they have a very good prognosis, but that depends on the early diagnosis and identification and referral to the mental health specialist. So I would advise that anyone who is suffering from these disorders or these symptoms may contact a good mental health professional for a timely advice and for prompt treatment, because these disorders are not there for the rest of your life if they get treated on time. And apart from that, we are also facing a high rise in sleep issues because of excessive use of screen time and excessive social media use. So for that purpose, I think there should be certain limitations and certain restrictions from our own side. We should be very vigilant about what we are watching on mobile cell phones and other screens, and we should also limit our screen time not more than 2 to 3 hours a day. Where it is necessary, obviously, a few people work online and they have their desktops in offices. Over there, there's like this use is inevitable. But otherwise, whatever we are using, that should be limited and that should be kept in check. And as far as sleep disorders are concerned, sleep disorders can also lead to some psychiatric issues because after 12 o'clock, otherwise, if you're sleeping, your blood cortisol level starts declining. But if you're awake, that may rise and that can cause a lot of stress that may lead to increased or disrupted levels of cortisol, may lead to dysfunctioning of cardiovascular symptoms, and that can lead to hypertension, that can lead to other cardiovascular problems. So in order to keep these things in balance and in check, we need to look after our sleep hygiene, and we also need to add exercise as a lifestyle modification in our daily